Psychoanalysis, irritation, the taste in the surreal. Irritation, like boredom, reverie, and frustration, is among those areas in psychoanalysis that has not received the centrality and the focus that these subjects deserve. Reverie and frustration have been dealt with to some extent, but boredom and irritation the least of. Today we go into this difficult to conceptualize area of irritation. Why is it important? What does it mean? How do we encounter this in therapy? And how do we go about understanding it and healing? And we'll do it with a specific reference to the element of taste, which is inborn, partly cultivated, and this whole idea of surreal, the world of imagination, the world of fantasy, the world of all that is not banal, that is not factual, the surreal as I call it. How does the taste operate in the surreal, and how irritation as a psychic entity is associated with? So let's start with what irritation is. We can start with three basic actors that populate the realm of the mind: thought, action, and feeling. Irritation definitely is not just a thought, you feel it viscerally. It is also not action. So if something is not a thought, not an action, by default, and partly by definition, and partly by substance, it gets classified as an affect. So irritation is an affect. Irritation can also become a state. We say, I feel irritated or I am irritated. When we say, I feel irritated, we refer to it as an affect. When the affect consumes the whole of us, it becomes a state. But the state, of course, is the result of the affect. It is definitely on the anger spectrum. The affect of irritation definitely is on the anger spectrum. And it's definitely not on the sadness spectrum or the guilt spectrum. So we know what it is and what it is not. It is an affect, not a thought or action. It is on the anger spectrum, not on the sadness spectrum, not on the guilt spectrum. It is also an hydraulic entity. It's very unlike envy. Envy is something which we find difficult to classify. Should we call it an affect, or should we call it a state, or should we just call it a thought? Because we don't find that kind of hydraulic feeling in envy, the type of hydraulic feeling that we find or we experience when it comes to sadness, anger, or guilt. In fact, this difficulty is common with not only envy, but also with inferiority and shame. Because although shame is a hydraulic entity in one way, the nature of that hydraulicity is very different from the nature of hydraulicity that we see in anger, sadness, and guilt. Anger, sadness, and guilt, if we use certain techniques, are more prone to being catharted out in a centrifugal way. But in inferiority and shame, there is a kind of withdrawal. There is a tendency to hide and almost vanish, especially in shame. So although shame is a hydraulic entity, it's a very different kind of hydraulicity. That's one of the reasons it does not yield easily to ISTDP techniques. So irritation that way is definitely a hydraulic entity. It's neither like envy, which raises questions, nor like internalization of a good object, which is completely non-hydraulic, nor it is like shame, which is a different kind of hydraulicity. So irritation in that way is a very classical hydraulic entity. It is difficult to conceptualize like boredom. irritation and boredom are very difficult to conceptualize. One of the reasons why few people have theorized upon it is the sheer difficulty of it. It is an aggressive response to soft desire frustration. Anything on the anger spectrum, anything on the sadness spectrum, obviously is because of some frustration of desire. So this is an aggressive response, not necessarily a full-blown anger, but definitely an aggressive response to soft desire frustration. It does not involve a direct attack or frustration of a regular desire. That will provoke anger, not irritation. So there is a zone of anger and there is a zone of irritation. Irritation largely involves soft desire frustration, like somebody in the restaurant makes noise with the spoon while he is eating. Now, he has not attacked you in any way. He has not done anything to you. He has not frustrated any desire of yours directly, but indirectly a preference has been frustrated. This kind of soft frustrations, they usually lead to irritation. Irritation can also come out of something very visceral that you don't like. Say the screeching sound of metal. That can also provoke irritation. But the irritation of somebody making sound with a spoon is different from the irritation of that metal scratching. So we will look here at soft irritation and hard irritation. Irritation has to do largely with frustration of taste, frustration of soft preferences or even hard preferences, largely in the surreal. It may not have to do with something banal. It may have to do occasionally, but largely no. Largely the taste frustration happens in the surreal. And this is something you have to go into. This is something called taste, which is inborn, and later on by culture, partly it is cultivated. So partly we are told what is irritating and we accept it, and partly something we naturally feel is irritating. So the taste in the surreal and the events in the environment, when they don't match, and this would happen if a child is born with a very refined taste, a very high taste, and the family members are crude, relatively speaking, unsophisticated, relatively speaking, unsensitive, non-sensitive, non-cultivated, non-refined, and non-aesthetic given the child. And that would lead to a lot of irritation on an everyday basis. And one of the ideas there will be, the moment child sees something which corresponds to his taste, he will feel at home and he will feel very happy. Let me give an example. Let us say a child is born in a lower middle class family in 1970s or 80s. And everything around him is very coarse, very unaesthetic, very tasteless or low in taste, so to say, very crude, very banal. The language family members use, the way they dress up, the way they eat, the way they talk, the way their preferences are, everything is far below the levels of taste of the child. And this brings in the element of the inborn taste, because if everything was behaviorally learned, there would be a complete compatibility, but we don't see that compatibility. Does that mean there is nothing learned? Obviously, that extreme also is false. Definitely, one is product of the environment to some extent, but there is a very strong element of taste, and in some children, this element of inborn taste far supersedes all that is learned, regardless of the sheer weight of the environment. So let us, I was going to, on an example, let's say a child is born in 70s or 80s in a very coarse, banal, unaesthetic environment. And he finds a book somebody gives him as a gift, which is coming from UK. It has all the pictures very beautifully done of cars, of farmlands, of houses of UK. And he instantaneously finds himself at home. This is his taste, his aesthetic. This is what he wants. So when the child finds oneself in the environment of one's taste, with people of one's taste, he finds himself at home. And usually when he does not find it so at his home, there is a clash between the surreal taste and the events in the environment, the family members in the environment. So initially it starts with soft irritation. Somebody does something that is banal or crude or unaesthetic, it leads to soft irritation. If it repeats itself over and over again, it solidifies, consolidates into a hard irritation, and then it matures into anger. Now let us look at the canvas of irritation, the types of irritation. How can we classify various types of irritation? We can classify irritations into soft and hard. Soft irritation is that which is felt when somebody transgresses our preferences, and this does not happen over and over again, and when you point out, the person undergoes a change and stops. Hard irritation happens when something keeps repeating itself, and soft irritation repeats itself, and when we point out, the person refuses to change, rather attacks us in some cases. So soft irritation gets into hard irritation. Hard irritation can also come in a social situation where one feels a sense of shame because of what somebody related to one does in public. And soft irritation usually happens in one-to-one or a family environment where the other and the whole sense of social shame is not there. Second classification can be irritation which is just anger half processed versus irritation which is accompanied by disgust. So you can have irritation which is just, you feel irritated, which is just like 2 steps away from anger. Or you can feel irritation with a sense of disgust. Then why does this person do it? He's so disgusting. Every time I meet him, I feel so disgusted about it. Another classification can be irritation that is experienced in a state of cohesive ego and irritation that is experienced in a state of disintegrated ego. Soft irritation, irritation which is standalone, irritation which is not very public shaming, usually does not disintegrate the ego. And the ego remains cohesive, and in that state we experience that irritation. So we just feel annoyed and we want it to end and we want to go away from that place, but we don't feel like screaming or shouting at the person. But irritation that is so strong that it disintegrates the ego, there we feel this whole impulse to shout at the person, and occasionally one may shout at the person. So there can be disintegration of the ego, partial or substantial, by the sheer amount of irritation which is accumulated. And often this irritation may not be one-time irritation, it may be accumulation of something, and then there is a last straw on the camel's back. So this is irritation that is felt in a disintegrated state of the ego. Another classification can be irritation when one expresses out the discomfort, the proto-anger, the soft scream, the soft annoyance to somebody, and irritation that cannot be expressed is either repressed, and is repressed too many times, it turns back upon us. So this also is one way one can look at irritation. Irritation that goes out in expression, in facial expression, in verbal expression, and irritation that turns back because it cannot be expressed or it's too much of it. Last can be irritation that is accompanied with shame and irritation that is accompanied with guilt. In the first category of shame, the feeling will be to feeling getting small, the impulse to withdraw, to go away from that place, get alone in the room, shut oneself up and vanish. And irritation when it comes to guilt, the whole idea will be to there will be a unconscious movement of soft punishment of oneself. Irritation and the surreal. Irritation is because desire is largely in the surreal. Irritation also is largely in the surreal because it's a frustration of soft forms of desire. And here we have to understand the idea of taste. Partly it is inborn, as I said before, partly acquired. And we can have a situation where if anger expression is completely repressed because of the environment, one can get into a state of producing soft anger, which looks like irritation, or irritation held back turning into soft anger. That's another state that we encounter here. And as I said, it is largely in the surreal, and the more imaginative the child is, higher is the inborn taste, higher is the taste he is exposed to, and lower is the reality forced upon him. That difference will cause irritation. Think of this. You go with a friend of yours to a fine dining hotel and he doesn't know how to eat with the spoons, and you feel irritated and slightly ashamed. It's irritation coupled with shame. The soft irritation of taste frustration, it can be generated and repressed and one never knows. And the cycle can keep going on. And over a long period of time, it may get into somatization in the form of skin problems, itching, scratching, or asthma. An important point, as I said before, is the moment one gets a taste compatibility, one suddenly feels happy at home and one realizes how a restless state of irritation one had normalized. Because this irritation, when it's repressed, it will lead to some form of agitation and restlessness. And that gets normalized by the mind because the mind is such an instrument, it can normalize anything. It's only when we see something higher that we realize what we had normalized. The element of taste goes in two ways. Personal preferences, number one, personal compatibility, number two, and social compatibility, number three. So the taste goes in three different directions, three different levels. And this whole idea of taste-driven individual compatibility, taste-driven social format that we can provide to the individual, and taste-driven orbit within the social format that we can provide, they remain something which is far in the future, where we will have different social formats and individuals will choose the social format and orbit within each format based upon their taste, their state of evolution. So it's a long way to go. If you want details of it, you can see the lecture on cultural compatibility. Sorry, cultural pluralism. Cultural pluralism. There I go into this area of how individuals can seek out compatible formats. Compatible formats of culture and society. Relating irritation and symptoms. How are the two related? Obviously, any negative effect, if it's repressed for a long time, and if the bucket starts overflowing, too much is repressed, it will get into symptoms of some kind. The same is true of irritation. What can it lead to over a long period of time? First, it can lead to ego disintegration. This happens when somebody is living with a passive-aggressive person, usually a passive-aggressive narcissist, and that person keeps irritating you as a part of his passive-aggressive movement. And it's done in such a subtle way and such a well-covered up way, with plausible deniability always packaging the whole thing, that one finds it difficult to first identify that somebody is doing because it's so subtle. Second, articulate what wrong somebody else is doing, again because it's so camouflaged and always couched in plausible deniability. Also, there is this whole point of something which is done out there overt and concrete to something which is done psychologically covertly. Anything that's psychologically covert, it goes into the world of psychologists. No regular person can find it out or even prove that it exists, leave alone taking precautions against it. So living with a passive-aggressive person, especially a narcissist, passive-aggressive narcissist, that irritation starts accumulating in you and then goes into repressed anger, and that can lead to ego disintegration, which can be wrongly diagnosed as anxiety. Second is, it can lead to episodes of screaming after long-term accumulation, and the person will be diagnosed with depression when in fact it is the passive-aggressive irritation which is put into him by the other person. This leads to a very important point which we had discussed before. What is in me but not mine? With a passive-aggressive person, one has to be very clear that if this screaming happens, always check, is it because of the depression of the patient, or is it because he is living in a pathological environment, or is he living with a passive-aggressive narcissist? It can lead to itching, which cannot be medically explained. And the itching can take any form. It can just be pure itching. It can be itching coupled with psoriasis or itching coupled with some skin ailment. So that can be somatization of this irritation. It can lead to depression. And when it happens that irritation leads to depression, it will not be alone. It will be irritation plus anger and some sadness. It will be a combo, and irritation will be one part of that combo, which will lead to depression. In fact, I have seen people who have started having even suicidal ideation because of this combo of irritation being a major part and coupled with some anger and sadness. It can lead to avoidance. In a way, it's good. You're avoiding what's irritating you, but it can lead to dysfunctionality when the displacement happens and you start finding somebody irritating instead of somebody else. So that avoidance comes up because of irritation, and that in family matters can lead to a lot of problems. If one spouse finds the other irritating and avoidance starts, creates difficult situation for the child. This irritation can be, as I said, response to passive aggression, which is one of the worst forms of irritation, because often it is couched in the language of love and care. It's often couched in the language of idealism. And it takes a lot of time and most probably help of a therapist to make out that in the center of the package of love and idealism and care and concern is this passive aggressive movement. Irritation occasionally can also come in cases of sexual abuse, where after the abuse, the victim starts feeling guilt and shame as though he is responsible for inviting the abuse. And there, part of the anger is generated, and another part of anger is stopped in its tracks. It is stopped quarter way in its manufacturing process, and that becomes another form of irritation. And in such cases, in the adult state, often one finds some sort of itching problems in the sexual area. So if you have an unexplained itching problem in the sexual area, or the moment one gets into the sexual act, one finds irritation, or the moment one talks about anything sexual, one feels irritated, then one has to look at some sort of abuse where the person was not able to fully mobilize and metabolize the anger which was due, and that quarter felt anger, that quarter manufactured anger, that is still remaining there as irritation. And usually it goes when the whole anger is felt along with irritation and sadness. But before that can happen, we'll have to address the guilt and shame. Only after that, this flow usually happens. Irritation may also lead to bouts of anxiety when part of it gets converted to anger and then starts coming up, and signal anxiety creates those bouts of anxiety as that irritation and anger starts coming when too much gets repressed. And irritation, too much of irritation coupled with anger and a complete bottling up can lead to self-destruction in various ways. It can lead to self-sabotage of career. It can lead to self-deprecation. It can lead to denial of pleasure for oneself. It can lead to denial of good things I don't deserve. Or it can lead to actual aggressive self-harm. So these are the very common symptoms that have their roots in repressed irritation. How do we encounter it in therapy? Two ways. One, how do we encounter irritation in therapy? And second, what we do to heal irritation in therapy. Two questions. First, let us see how we encounter irritation in therapy. The patient can tell us, you are irritating. And that may be true, that we are doing something irritating out of our own passive aggressive nature unknowingly. Or it can be a transference. Somebody in the patient's life was irritating and therefore we are seen as irritating. So this can be one way in which we encounter irritation in therapy. It can also be if we persist in our exploration with the same question again and again. If we don't change the language of the question and we keep persisting, that can also bring about irritation. Second is, irritation is felt by the patient viscerally in the therapy room. That the bottled up irritation is somehow activated, and once the patient feels it, that may be a good thing. Maybe you have provided safety enough that difficult feelings can now be felt, which is a very good thing to happen in therapy. And it can be accompanied by memories which we can go into. And we can also help the patient in catharsis later on to feel the irritation fully and let it go. Irritation can also be felt by the therapist because of projective identification. So if the patient does not feel equipped enough to deal with his own irritation and he wants to deal with it, he may transfer it into the therapist and the therapist may feel it. There it is best to bring it in therapy for discussion. And how do we heal it? The first is awareness. Awareness is a great tool. Once you equip the person also starts one's own deeper exploration along with the therapist. Like any affect, we look at irritation in terms of generation, manifestation, expression, symptom formation, healing, and remission. So here we look at generation and we talk to the person where you feel irritated, how it is generated, and what can be done about it. Can we change the way the thoughts happen? Can we bring in thought instead of just bringing in feelings? Can we look at our expectation? So on. So we work on the awareness part of it, the generation part of it. Then we look at how it's manifested and how not to stop it in its tracks, but allow it to be manifested fully without fearing it. And then slowly as one feels it, one gets it into the conscious mind, catharsis happens, remission will start. Very important is the work on preferences and the capacity to bear something contrary to our expectations, our preferences. So this is very important, the whole discussion on taste and preference. Often we cannot heal something only by analysis, and one has to go into experience to heal it. And there we help the person, or we suggest to the person, or discuss with the person to understand his taste and satisfy the taste element of desire. And see how when the taste is not satisfied, the anger formation and release of the anger formation and irritation formation can happen, and help the person release it. We also help the person, not help, we discuss with the person to enrich the surreal in terms of taste. And that will include many other options of satisfying the taste in many other ways. Discussion also gets into search of people and places which are suited to one's surreal, finding compatible environment. Because at least to some extent, the desire has to be satisfied. We cannot heal the desire fully only by analysis. If we use ISTDP tools, then we encourage the person to viscerally feel that irritation in the body. And often it is accompanied by anger, and then usually sadness also comes up. One can use art therapy, psychodrama. These can be good ways to complement the classical psychoanalytic process when it comes to healing of irritation. In art therapy, one can guide the patient, or not guide the patient, at times discuss with the patient to use art or to consume art to explore this whole area of irritation. It's a way of exploration, it's also a way of expression, also a way of release. Psychodrama also can be a very effective tool where somebody can reenact those scenes which lead to irritation, and then having consciously felt it with awareness, lived with awareness, go about analyzing it and cathartic it out. In holistic healing, we have two holistic healing tools, pranic healing and Reiki. They also engage with irritation in their own ways. Pranic healing engages at much greater depths and in much comprehensive scope. Reiki engages in a soft way, in a limited way, with irritation. And if one is interested in holistic healing, then apart from art therapy and psychodrama, one can also take help of pranic healing and Reiki. One can get it done by professionals, or one can learn it and do it on oneself and be independent. So this is how we look at irritation in therapy in terms of its encounter and in terms of its meaning. Thank you.